Exercise is really beneficial for patients with PoTS and syncope because it can provide a lot of health benefits. It can provide symptom management through increasing things like blood volume and the muscular function, especially to do with the heart, how well that functions, and also the leg muscles as well, because it's involved in a lot of techniques that the patients can use with symptom management.
One particular research interest we have is looking at treatment of PoTS and syncope. One particular research study that we are currently undertaking is looking at the effects of exercise training in PoTS and syncope patients and seeing if it can help form an effective additional treatment to their management strategies that they might have, such as pharmacological aids and so on. The initial results of our research study into the effects of exercise training on PoTS patients in particular has shown that it can have a beneficial effect on a range of variables that are very relevant to PoTS patients. So for example, we've shown that in some patients at the end of their exercise training program, they have a much reduced heart rate response to the upright posture, which essentially reduces the extent of the tachycardia when they stand up, and can in some individuals mean that they don't meet the criteria for the syndrome. We've also found that it helps improve the patients on a range of other features such as depression and quality of life. So it can improve their quality of life, reduce their depression, and also quite importantly as well, it can help them exercise or be physically active a lot more, be able to take longer walks, go to the shops more, or just participate in sports or hobbies that they might not have been able to do previously.
3 top tips I'd recommend for exercise for patients with syncope or PoTS would be: number 1, be specific. Use the exercises that are going to get you the best benefits, like cardiovascular exercises, seated bikes, walking, to produce good benefits through the heart muscle and function. Number 2 would be progression. To start off small duration, light exercise, and build up as the weeks go on. And the final one would be reversibility. If you pause from exercise due to work commitments or illness, it will be hard to get back into the exercise at first, but just reduce it down and progress through again, and don't be put off by this. It will be harder, but you can get back to where you were before.